I said you can be an elbow guy if you come big open elbow fractures in the middle of the night. And you said you don't know what a fracture is.
Yeah, I often say that I'm a fair weather elbow guy. You know, I'll do a sportsy elbow.
Do it for the
I'll do the distal biceps, the triceps, but then when you start talking about hyphenated procedures that I've never heard of before, I don't. That's not me. I'll make it you a real expert. All right, I think I'm well, thanks. Feel free to grab some refreshments and coffee. This is a totally different take on the topic, and this is one that I think is a topic that we don't often get a lot of formal counseling on. And so I know we have students and residents and folks that are looking for jobs in the not too distant future, and folks that really want to charter a path and figure out how to make a dent in this field. And I'm going to go through all of that, at least in part. My disclosures have not changed. They are available on the Academy website. I just want to really thank the UVA team for having me. You've got an incredible group here. I love a baby-faced Steve Brockmeyer here and Winston Guathney. Slight changes have occurred. I got the chance to re-meet Michelle at AOSSM, and I think she's going to come in with a lot of force and energy. So I'm really excited that she'll be joining your team. Well, Winston, he went over some of this, but I'm a military kid. My father was a career logistician in the military as a quartermaster officer. He was drafted in Vietnam and did not have to deploy. So we moved around. We lived probably in like 13 places by the time I graduated high school. I did 2 years in Killeen, Texas. I graduated from Northern Virginia. And went down and played soccer at Elon, as I mentioned. Transferred to University of Virginia. I remember coming up on a quick visit and saw how much fun everybody was having, and quickly transferred here. I graduated in 2002, as I mentioned. I say that I did a gap year just so the kids respect me, but truthfully, I did terrible on my MCAT, and I needed to resurrect my academic credentials after 3 years at the university. Not an uncommon story, right, Winston? And from there, I just started carpet bombing every institution that I can to try to see if I could gain access, Dr. Miller, to higher education. It was not easy, and so that is part of the humbling process of I think my story, and I definitely want to convey that. I joined a program called the HBSB program, which just allows you scholarship to have debt forgiveness with medical school tuition. They give you a stipend. And so while Winston and some of his colleagues were eating ramen, I was living off that fat cat government salary that you all have subsidized. But then when I got into practice, I think the tides had turned. So I always like to show this slide. This is my dad as he came home from the Persian Gulf, and then fast forward, my brother did the same program that I did in residency in the same location, and so that's our family there. I talked a little bit about what it was like circa 2002. I was at the height of my academic prowess. I was graduating with a degree from University of Virginia, onward to the next thing, and then failed to gain access to medical school and moved into this little hovel in Richmond, Virginia, in the fan. And I worked at Massey Cancer Center and VCU to both take classes and then additionally to retake the MCAT. And I always talk about when I finally did get through medical school, and then fast forward, and I'm applying for many different of our military residency programs. These were some of my colleagues. This is Dave Crawford. He's in a great practice in Ohio State. Uzandu Agachukwu, who's down in Augusta, and then Doug, who's out on the West Coast. But these were all the guys that I was competing with. And as I went through my rank list, and I remember Winston calling me this day and saying, "Where'd you match?" And so on my flip phone, I just replied back that I ended up in El Paso, Texas, which, has anybody ever been to El Paso, Texas? Sun Bowl or what?
Yeah.
Yeah. It's usually Sun Bowl, drug trafficking. I mean, take your pick. It's one of two things. And so this is where it all started, you know. So the humbling process of getting into medical school and then applying for residency, ending at your fifth of six desired location, and going to a place that I had never been to. It was definitely a great opportunity to start anew and explore a different part of the country. And this is a concept that I often focus on, which is that of a found family. As a military family, you are constantly thrust into new environments, and you're getting exposed to new people. You're thrown out of your comfort zone. And so, you know, the family you're surrounded by is not necessarily always people that you choose. And the military is no exception. So this was our residency as I started on as military staff, and then just a couple pictures of our experience from down in El Paso. The nice thing about the military is they will give you an all expense paid beachfront vacation. There's not much water, but Afghanistan will teach you things about yourself. I mean, when else are you going to be able to do gas mask PT with your best colleagues in 140-degree heat? And this thing in the bottom right is called a haboob. You want to get inside when you see that coming on the horizon. And these are just some of the guys that I would work with. But what that does is, you know, that puts you in community with a lot of very high achieving people, and iron sharpens iron. And so as you're surrounded by these military orthopedic surgeons and other folks, I think that that's been a great opportunity for me to hone my skill set, but also to cultivate talents that I didn't realize I had. But the bigger question, I think that the military does a good job of defining early is why we do what we do. And it's guys like Taylor here. This is a guy that was trying to qualify for special forces. He had failed 3 prior arthroscopic stabilizations. He was sent in by one of my former residents. And so trying to get him back to be kind of so-called tip of the spear is primary focus for us. And so we were able to do Ladder J. He is fighting bad guys and doing a lot of clandestine work in parts unknown, but he sent me some of these images, and we've documented his story. So trying to find your why, and that'll definitely lead you to your way. So I'm going to talk a little bit about that, especially as you talk about the early first couple of years of establishing a practice. I love this quote. You know, wisdom comes from experience. Experience is often the result of a lack of wisdom. Winston, you and I have a lot of wisdom. Okay. So the cold hard truth, you know, we know the stats about people leaving their first jobs and transitioning to different practices. So how do you engineer a match and a fit and have transparency about what you want, what they want is an area I'm just going to focus on for a handful of minutes. What's the issue with changing jobs? Well, there's a lot of stress and financial loss. There's lost income, there's moving expenses, you know, there's this concept of tail coverage, you have to repay signing bonus, but also it's the opportunity costs. All that time that Dr. Gwathmey has put into cultivating this hip practice, right? Hip preservation. Now he's got to take that, move that up to New York City and redefine it again. There's a lot of time involved. And as you think about a large city, large metro environment, that's probably a 5-year growth process. So Winston, we could still turn this around. I mean,
Please.
But at the crux of this, you know, asking these questions of yourself is very important. What motivates you? What are your areas of interest? You know, where do you prioritize things? Who are your mentors? What are 5 and 10-year goals? How do you plan to achieve these goals? How can you optimize your efficiency? And what type of practice environment would you like to be on? You know, think about these things long and hard, introspectively, and I think that'll help to lead you through some of this process. Private practice it's interesting. It's a little bit of a dying art. The success or failure of our orthopedic field is going to be wholly dependent on these groups because they help to keep large health systems in check, as well as insurance carriers. And so the nice part about what they do is they're autonomous. They have ancillary income opportunities. I would say that this is a classic gold standard, but you have to work for everything. And there's a fair amount of overhead that you have to compensate for and buy-in required. So a lot of cash and liquid investments. The multi-specialty group is a little different animal. There's a higher average overhead because you're having to offset some of your other non-operative colleagues, and you need to subsidize your primary care network. So as you look at private practice questions, these are some of those that I would definitely filter into any of your interviews that you go through. And I'll provide these slides so that you can access this if you're interested. Hospital employment. Certainly there's a lot of interest in hospital employment. You don't have to compensate for any of the overhead. There's less administrative responsibility. There's these high upfront salaries, but then you're going to be gradually reduced on your autonomy, and that salary is going to be renegotiated every year as you try to meet your productivity metrics. So make sure that you're considering not just what they're providing up front, but what's to come. These are some of the questions that you want to really drive in on. And then really talking about the university or academic framework. This is always where I wanted to be, but I did interview broadly when I was looking coming out of residency and fellowship. There's a lot of potential advantages to it. There's certainly a prestige effect. You can cultivate a tertiary referral network. There's access to residents and fellows and other learners. There's a university. Obviously, University of Virginia is no exception. But, there's one of the biggest things that one of my colleagues, Al Stubbs, says is to change things in an institution. It's like steering a battleship. It moves at a very slow rate of speed. And so you have great stakeholders in your chair, but things don't always move as swiftly. So, the questions you say is, will I get protected time? Will I have a lab for access if that's what we want to do? How are cases divided up? What's my forward progression on professorship? And one of the things that we've been really delving into recently, how is scholarly activity rewarded? How do we cultivate that? And what are your goals? Trying to orient these into a specific order, I think, is helpful as you start to lay things out. That's Werner just woke up. I put the gym tan laundry Jersey Shore up.
Well, it's actually your last bullet point that woke me up.
Listen, we've all met that person, right? So important considerations to the practice. Trying to consider which one of these models is effective, and I would encourage you to interview broadly. That's going to allow you to better tailor what you think about yourself and seeing what environment will bring the best out. Well, then how do you find that right opportunity? I think word of mouth, there is no substitute for that. Some of the best job opportunities are not publicized. So as you look at those that are showcased in JVJS or AAOS now, there's probably a reason for that. That's been on the vine for quite some time. And so that's really probably not the best avenue to find the jobs. Colleagues and program directors, I rely heavily on industry contacts when I'm trying to connect somebody with a given market, because they can often say who's going to be leaving shortly and what are the immediate needs. And then, considering cold calls, or in this case, emails, while looking at some of these other more traditional opportunities. Well, I include this. This is a sample unsolicited email. This is an email I sent to Dr. Diedek. This is back in 2015. I think I had just completed the match. I said, I hope you had a great Thanksgiving, blah, blah, blah. Sorry we couldn't pull it out against tech today. If you have any job, please don't hesitate to reach out. But what I wanted to convey is, what am I bringing to the table? What type of skill or core assets could I bring to the group, to the orthopedic group? Convey that I'm willing to work for anything that I want, and then just try to establish an initial point of contact. And so classically, you get then the dignified response, then gentle letdown. Dr. Deduck, gives some context here. He says, thanks for your email query. We remember you well from your interview visit. Congrats on fellowship. At this point, we do not plan to expand our faculty in 2017. We're adding somebody this summer. Don't plan to expand further unless they have unplanned changes. And we'll keep you.
That was me.
Wish we could go back.
Winston's job.
I know.
Wish we could go back in time.
But I think that I started out by sending these emails to pretty much every major academic center within the Mid-Atlantic region, and I sent it to the chair, I sent it to the section head, and if there was an administrative point of contact, then I sent it to them. Now, the section head's never going to want to add you because they never feel like they need to have more business, right? There are more surgeons. We can handle it. The chair will often have a little bit of a larger perspective. And then the administrator sometimes is the go-between to try to arbitrate that. These are just some of the ways that you might be able to evaluate for it. Certainly AAOS has a job board. Several subspecialty organizations do too. So utilize that, but the word of mouth is key. So then it gets to the phase that we're talking about with, Winston and programs in New York and trying to figure out how you negotiate. I think many of us feel uncomfortable in having these discussions, but you need to be your own best advocate. You need to take inventory on what you bring to the table, and you need to know the market that you're going into. So as you evaluate these parameters, you want to make sure that you don't settle. Certainly there's things you want to build into, but making sure that everything is written down on some form of term sheet, I think, is incredibly important. And engage early with a contract lawyer to make sure that they review all these things. You do not want to get stuck revising things in at a later date. But then it goes back to kind of how you fill your cup. What are your goals? What do you want? For me personally, I wanted to develop my surgical skills. I wanted leadership opportunities. And then at that point in time, I was really interested in more of this translational and clinical outcomes research. And I felt like an academic framework would best facilitate that. And metrics, when I was leaving the military, I wanted to know, how many cases did I do? And 300 cases in a military system is like 1,000 cases in the civilian network. It's an incredibly slow and arduous process to push volume. But knowing what you contribute on the clinical side is important because that's your revenue generating opportunity. And then trying to assign whether you can bring some grant funding, how many publications you're bringing, again, the subject matter expertise, and how you can contribute on the leadership side of the house. So then the other questions is how do you get there? I love this from Steve Burkhart. He talks about the burden of craft. And, he decided early that he wanted to be an excellent shoulder surgeon, but he started out doing hip arthroplasty in rural parts of Texas. But he committed himself to incremental growth, definitely against heavy scrutiny. And, you don't judge yourself against other people. You just be better than you were yesterday. And if that story sounds familiar, that's Mark Miller in a nutshell, right? He has continued to iteratively improve. We were talking last night. I always thought he was a Macy hater. And he said even in his late stages of the career, he's turned around and it's open. So be that journeyman or woman that is going to continue to explore ways that you can improve yourself. And then maximizing your exposure. You really want to establish role models, allies, mentors. You've got so many in this room, and that's great. But among that is stepping out of your comfort zone. So last night we were hanging out. There was like the fellows in the attending circle, and then there was the resident circle down at the bottom part of Dr. Brockmeyer's estate. And, we had to kind of blur the lines and go down and start talking to people and do that. Leave the comfortable circles that you have established within your UVA community and chat with people, different programs, because you might get exposed to new people, new mentors, and those regional allies are great. This is my residency program director. His name is Phil Belmont. He was the one wholly responsible for bringing me down to El Paso, Texas. So once I got through the forgiveness phase of that, we really developed a friendship and a bond that continues today. He now works through the FDA and implant clearance and is in a non-clinical role, but He was such a critical role model for me, but he wasn't a sole source. So I really used the mentorship of him, of Brett Owens, who's now editor of AJSM and was one of my early attendings, Joe Shue, who's a traumatologist down at Charlotte Atrium. I think combining those mentors, there's no shame in doing that. So make sure that you're seeking out multiple roles. Ideally, it's a bi-directional relationship. You know, it is your responsibility as a resident, as a trainee, to engineer the discussions. So make sure you're putting it on the calendar. I would encourage it to be a quarterly or every 6 months discussion, and make sure that you don't just choose the nice person on faculty, but somebody that matches up with what your goals and ambitions are. This just reiterates the importance of it being a two-way street. This is an article that we wrote in the Yellow Journal with several of my colleagues that kind of lays out some of the framework of what we think is a successful mentoring relationship. But, you know, at the end of the day, you are using these mentors to try to catapult your career to the next level. And so these are individuals that I found to be very helpful for me. And I would kind of establish your Venn diagram. Winston, who would be your biggest mentor?
All this room, probably Mark and Bobby and Dave and Tom Gill. And
It's a heavy tie, right? You know, you look at all these people, all these touch points. It's not just one person. So what else can you do to network? I think that you see a lot of examples of this in the room as well. Maximizing your exposure through involvement in your subspecialty organizations, but then also focus on the bigger room of orthopedics and musculoskeletal care. You can definitely engage with traveling fellowships. You can do DIY site visits. Like I've done several of these to go to other locations to learn a skill set, to put your practice on pause. And then attending and teaching at courses has been incredibly instrumental for me. I think I've been to about 40 OLC courses, and each time I emerge with something new. These are just some of the networks that I continue to be engaged at. And one of the things that Dr. Warner and I have really gleaned a lot of interest and engagement from is the international community. I think that we are a little bit in a silo here in North America, thinking we have things figured out. And when you go across the pond, it's just amazing the things that you get exposed to, novel ideas that are incredibly innovative. And I think emerge here 10 years later, right? Alternative bearing surface, the snooker ball, you know, thinking about acromial osteotomy. I mean, this is what I would consider heresy, but is now emerging here in North America. So I would not be ashamed of looking at DIY education pathways. This is just some of the ones that I've kind of leaned on. But these traveling fellowships have been a great opportunity for young orthopedic surgeons that are looking to gain exposure to other ways of doing things. I'm sure UVA gives you a very balanced training program, but it's important to know that there's a lot of different ways to skin that cat. And I had the good fortune of doing the Anna Traveling Fellowship, where linked up with Don Johnson, who's one of the pioneers from Canada. He's Mr. Sports Medicine in Ottawa, and he really helped to introduce to me some of the Canadian school of thought, how they approach ACL reconstruction, multi-ligamentous knee, and from there, really, he introduced me to another giant in the field, and that's these folks from Mayo. And Bruce Levy was one of my hosts at the tail end of the military experience. I took 4 weeks and went up and spent it with Bruce, again focusing on multi-legs, and that's a relationship that continues to pay dividends today with the International Knee Dislocation Study Group, with involvement in research studies. And he's a person that is a good friend and mentor and a good role model for life. And then there's kind of these near peer relationships like Winston mentioned. So Mac and I spent 4 long weeks on the road together. And when I think about somebody that has boundless energy, Winston obviously comes up, but Mac is really in the conversation. How many of you know him on a personal level? Okay. If you don't, you should get to know him. The bow tie should be a tip off. He's not messing around. He's the chair of Pitt, and he's succeeding in an environment that was led by Freddie Fu for a very long period of time. And he's just got a great business mind. He is a great ambassador for the UVA program, and just what incredible things he's doing in a really austere environment like Pittsburgh. It's incredible to see their reach and growth. And so we did the AOA traveling fellowship together, just the cast of characters. Again, it's individuals that are outside your subspecialty. And there's kind of a nice part about that, because there's some synergy that you can develop in collaborating on problems and seeing the ways that different institutions tackle this. I think that's really helpful. I'm sure Dr. Chauber can mention how much you glean from looking at how another institution has tried and failed or succeeded is super helpful.
Absolutely. When I started as chair, I visited so many other chairs and programs to learn.
And so we did the West Coast, and we talked a little bit about how we can better influence mentorship and leadership pathways. But it just improves your access to a lot of individuals across different networks, and we wrote up our experience here. Lastly, I'll just mention the AOSM ESCA Traveling Fellowship, which I think, when I think about professionally, the accomplishments that I had, this is probably at the highlight. This is the crown jewel. To spend 4 weeks on the road, traveling through Europe, spending it with my godfather, which was Ned Amendola, and seeing these amazing centers and all the fantastic things they are doing, not to mention eating at Paul Bocuse, which is the premier culinary experience in Lyon, France. And then you can see the library in Bologna. It's slightly different than the one we had in my residency. But the OLC, this is a great opportunity for you to cut your teeth. Scott and I were at the OLC this weekend doing the Anna Somos course, influencing skills development for young military orthopedic surgeons. And I think we all felt like we really put a dent in surgical training, and everybody was earnestly just trying to get better. So I think that look at those opportunities, look at these collaborative relationships. My other big ploy to you is review for a journal. I think that is a great way for you to continue to look critically at the literature, to be on the front lines of knowing what's coming out. It also contributes to your community. So these are just some of the journals that I contribute for. I've been an associate editor for arthroscopy, now no longer in that role. But it was a great opportunity for me to develop a critical mind and a skill set. When you talk about committee work, this is another great way to give back. These are just some of the opportunities that I've been involved with. So I chair the ICL Sports Medicine Committee for the AAOS. I'm involved with the Education Committee now within AOSM. And then I contribute on the podcast for the ASES alongside Peter Chalmers, who's one of my colleagues at Utah. And what a great way to experience excellence from other people from the comfort of your own home. Winston, you can truly wear shorts and not feel like you're dressing down when you show up for the podcast. But we've had such incredible guests on board: Jimmy Andrews, Steve Burkhart, so many leaders within the field. And so it's been an incredible opportunity. The other thing that I would just mention is collect outcomes. See how you're doing. If you're not trying to focus on the patient side of the experience alongside your surgical skills development, I think that you're missing a great opportunity. It can be intellectually stimulating. It can give you insights on how to improve, and then really how to improve the care experience. And this building is the representation and embodiment of that. So just some final take-home lessons. I think collegiality matters. I think more and more I realize the importance of just being nice to people, whether that's the person that's greeting you at the gate, whether it's the resident or the medical student that's serving as your liaison when you're doing some of these events. Ask open-ended questions. Your first reaction often is not your best one. So assume virtuous intent and be curious and not judgmental. I love that quote from Walt Whitman. And I'm really on a huge stoicism kick probably for the past 5 years. And I think you should be really strict with yourself and tolerant with others. that has its limits certainly, but it's important to realize. Dr. Warner, I'm looking at you. Because we often think about the infinite game, right? Which is there's no winners and losers. It's not a zero sum situation, and so trying to figure out where that we can have shared gains throughout is something that we need to constantly focus on. And this is a concept that lends itself to business, culture, relationships, certainly within your own houses. Realizing that you should be vulnerable and focus on shared gains. So these are just some of my tips for academic success, but I think I'll end with just trying to figure out who's your tribe. Who are the people that you take a lot of pride in? Certainly, this residency, your class, your section, your hospital. For me, this is our tribe. This is one that we've continued to build out at Wake Forest within sports medicine. These are my primary care colleagues. These are some of our APPs, who are the three small-statured women in the front, and then David Martin, not featured, Gary Paling, who just celebrated his 50th year at Wake Forest. It's incredible to have that type of experience lending itself to our team. These proverbs are great. If you want to go fast, go alone. If you want to go far, go together. I think rising tides raise all ships. So really invest in the people around you, into that group, and be greater than the sum of your parts. You've got a great team here, great facility. I love this article, Dr. Chabra. I was reading it in my clinic in between patients, and he says legacy is not a building. Legacy is a culture, and it's the people that you train, and you've got incredible legacy here. So I just want to thank you for having me. This is an excellent full circle opportunity, and I look forward to any questions and offer these resources for you. Thank you.
Yes, comments?
So Brian, I thought that was an excellent talk. Very well received. Fascinating, really, that our careers are very similar and you've done a fantastic job. I would add to your comments though about moving. People that move frequently often making mistakes because you need to establish yourself and you need to not move somewhere just because there's an opportunity for sports cards. That can go away. And so you gotta be careful when you look for greener pastures, because often it's because there's more fertilizer.
Yeah, no, that's a great point. Yes, sir.
Thanks. I think these comments are always inspiring, and your career has always been a good example to follow. One of the issues that always comes up when you talk about all the questions, when you say, what kind of practice do you want to go into, and then hear a bunch of questions to ask. The problem, I think, with lists like that is everybody knows what questions to ask, but you don't know what the answers should be. And so how do you determine, you're advising one of your fellows and you say, I got this great opportunity and you say, go ask all these questions, and they do, but then the key is, how do you figure out what the answers are? What's your pay structure? We've got this, this, and this. Is that good or bad? You don't know. You have no way to know. You have no way to put that in context. I think that's where mentors and obviously colleagues come in. But I remember when I was looking for a job coming out of fellowship, and I had all these lists, and I was like, I went and asked all the questions, and I'm like, oh, I don't actually, is that a good answer or a bad answer? Like, I don't know how to compare the answers that I got. They were very forward. Oh yeah, we'll give you all the information you want to know, but I didn't know what that information meant.
Yeah. Yeah, I mean, I think it's a good point. At least you have that information on paper. So I kept copious notes, and you would keep a spreadsheet. But then you take that back to your mentor, and you'd be like, well, what does this mean?
Yeah.
Is this a good dollar per RVU? Is this a right FTE? They say I have no admin time. Is that something that I should be buying in on? And then you try to figure out where can you push back, because you can't have everything. I mean, Dr. Jabra sees the other end of this, and I'm sure I always think about that Ben Affleck meme where he's leaning against the wall, smoking a cigarette. I'm sure he just gets exhausted of people coming in for asking things constantly. So there's a give and take. You have to figure out what are the most prioritized elements for you. For some people, it's pay. For some people, it's none, right? But but making sure that you can't get all those. But take that information back to your mentors and figure out, hey, how does this balance with what else is out there?
Right. Thank you very much. That was absolutely fantastic. I don't know if you'll ever wear this.
Of course.
You know? You may not wear it around Wake Forest, but just a little plaque, the Mark Miller Visiting Professor.
Thank you.
For this year. So your talks were fantastic. Thank you for talking about the elbow so I could pay attention. Good swag from us as well.
Thank you so much.
And it's great. Dinner was great. It was really an honor to have you here.
Thank you so much. Thank you, everybody. Appreciate it.
Sports guys, can I have you up here? Faculty fellows. Can everyone clean up? There's a meeting after here. And if you can help me take the chairs that we pulled in to the cafeteria.
Right, thanks.
Yeah. He's the reason why I know how to analyze the assets.
Waterman, make sure you really one of the specialists.
Okay. You got it. Come on here. Taking it out. Right.
I'm gonna stay in the middle.
You going against in front?
Yeah.
Should do that.
Yes.
Good, thank you, man.
I was one shit.
I took three out of it.
Let's
Get one opportunity.
What is that chair?
Right.
That's where she
Oh,
was
for-
participating in.
Yeah, no shoe print. This is the lightweight roller.
I don't know where Keith went.
Now I get on